I'm here, Dr. Alicia Macro. I'm here with our registered nurse and health coach, Adeline Melvin. And we wanted to have a chat today about irritable bowel syndrome because it's something I see a lot of. It's something that's super common. It's super misunderstood out in the community. It often goes untreated and it causes a lot of distress, lost work days, lost productivity, lost joy, and really want to talk about what it is and how we can go about reducing your symptoms as well. So Adeline's come to us as a coach from a hospital background, and so some of these general practice problems that we see are things that Adeline is still upskilling and learning about. And so we thought we'd use this as an opportunity for me to answer Adeline's questions, but at the same time also answer probably what some of your questions are as well.
So I wanted to ask if you could describe IBS.
Okay, so IBS is irritable bowel syndrome, and it's a condition that has what we call a clinical diagnosis. So there's no test or scan that we can do that diagnoses it, but we diagnose it on the pattern of symptoms that you have. And so to be diagnosed with IBS, you need to have had persistent symptoms for at least a few days a week over at least a few months. And you need to have a combination of either abdominal pain, which usually gets better when you do a poo, bloating, and constipation or diarrhea, or a bit of both. So they're the key pieces of the puzzle that we look for when we're looking at IBS. But we also need to make sure that you don't have another condition that could mimic IBS, something like Crohn's or ulcerative colitis or celiac disease or a bunch of other things. And so an important part of the diagnosis is not just recognizing the pattern of symptoms, but also doing a thorough check to make sure we're not missing something else that it could be that could mimic that problem. Even things like thyroid problems. There's a bunch of things that we look for. And so IBS should always be medically diagnosed with a GP and a specialist. And if there are any alarm features, sometimes that workup that we do with your doctor may involve something more invasive like a colonoscopy or an endoscopy or both, but it doesn't always have to. It really does depend on that individual person and their individual story. Does that make sense?
Yep.
Okay.
And what about the treatment?
Okay, so before we get to treatment, can we talk about why IBS is? So when I was at medical school like 15 years ago, IBS was something that we really didn't understand, and it was, we learned about it, was touched on in lectures and that sort of thing, but it was a bit of a mystery. No one really knew what was going on there. The way I normally explain IBS to people is that it's probably multifactorial, so there's probably a few different things going on causing IBS, but some of the things that seem to cause it are a problem with your nervous system. So your gut's got its own nervous system. Some people call it our second brain, like it's a significant nervous system that we've got in our belly. And if it's not working effectively, then you're going to get problems. So it is it's a bit like in IBS, I often explain, it's a bit like having an orchestra going without the conductor. So all the bits of the nervous system are doing its own thing. And so nothing's coordinated and things don't move properly and food doesn't get digested properly. So that's the first bit. The second bit is there's probably difficulty digesting certain things, usually carbohydrates. And so food doesn't digest properly. It sits, it ferments, it creates gas, and that's where you can get a lot of the bloating and discomfort and pain. And there's probably dysfunction with the microbiome, like the natural bugs that we have in our belly are probably not functioning that well, or they've probably got a funny combination of bugs, and that might be just genetics, it might be your diet that might have contributed to it, it might have been antibiotics, it might have been cesarean birth or not being breastfed, or a combination of all of those things, and we don't really understand that all that well because our individual microbiome is quite difficult to study, because a lot of the bugs that we've got in our belly don't like to grow in a laboratory environment. They like to grow in the belly and nowhere else. So probably a combination of all of those things are part of the problem, but it also means that understanding what parts of the problem there are helps us with the management, which was your next question. So the things that we normally look at here is making the diagnosis and ruling out any other sort of important things that it could be instead. And once we've made that diagnosis, then we can get on with managing it. And then from there, looking at those key causes. So with the microbiome, we want to be feeding your microbiome. So we want you to be eating foods that feeds those bugs. We've got about 2 kilos of bugs in our belly, and we want to be able to feed them. And that sort of food that we want to feed them is the sort of stuff that gets stuck in your teeth, like that really sort of fibrous vegetables, those sorts of things, healthy, unmodified, unprocessed foods. So that's really important. A high fiber diet, because our gut brain is really important. Because our gut brain is really important, looking at stress, because anything that upsets your brain and your nervous system is going to upset your tummy as well, which is where people often say if they've got a job interview or if they've got an exam, their tummy's way worse. So actually looking at meditation and relaxation and doing things for fun and reading and so forth, and also understanding what IBS is and that it's not something that's trying to kill me, it's something that, you know, is annoying but it's not sort of dangerous, is important. And then also looking at the types of foods we're eating too. So usually like at least 80% of people will benefit from what we call the Fodmap diet, which is basically avoiding chains of carbohydrates that people with IBS tend to have difficulty digesting. 80% of people get better on the low Fodmap diet. The ones who don't often have a problem with another group of foods. We call those food chemical sensitivities. So there's things like salicylates and amines that are present in different groups of foods that also can cause symptoms as well, which is why we often involve a dietitian in the management of IBS, because there almost always is going to be benefit made by having a look at your diet and then improving things from there. Perhaps, I mean, that's probably enough, I think, to talk about as a real introduction to IBS. But perhaps we can do another video, maybe next week or something, looking more deeply into the management that we do. Does that sound like a plan?
Sounds good.
Cool.
Thanks for listening.
Have a good day. Bye.